Hello, my name is Ryan Cowles, and I will be talking about electrical activity of the heart and how electrocardiograms, which can be abbreviated as ECG or EKG, can be used to determine cardiovascular age and predict adverse outcomes. The electrical currents of the cardiovascular system spread across the body into tissues and body fluids, which can be detected on the surface of the body. This means that the recording is of the interaction between the cardiac impulse and the body, not a direct recording of the heart itself. Also, it is not a recording of a single action potential, but rather a net effect of all action potentials, some depolarizing and some repolarizing at any given moment. Although each individual is different, there are distinct patterns in an ECG. The first little bump, right here, is called the P wave and shows the atria, those are the top chambers of the heart, depolarizing or firing. The second large spike, right here, is called the QRS complex and shows the ventricles depolarizing or firing. Lastly, the third bump is called the T wave and shows the ventricles repolarizing or loading. So this is the top of the heart firing, this is the bottom of the heart firing, and this is the bottom of the heart refilling. The sinoatrial node, also known as the pacemaker, begins the electrical firing of the heart, but is not strong enough to register on an ECG. It occurs right before the P wave, so right in this area here, and that's what's going to initiate the rest of the atria myocardial cells to fire. You may also notice that there is no bump for atrial repolarization. That is because it occurs as the ventricles are firing. So during the QRS complex, that is when the atria are repolarizing and therefore it does not show up on a ECG because the QRS is so powerful and it masks the repolarization of the atria. The atrioventricular node firing is also too weak to detect on a ECG, but occurs at the PR segment, which is right in this gap here. The cardiovascular system is responsible for circulating oxygen and nutrients to cells and tissues, as well as removing waste products. Cardiac output, or CO, is the product of the heart rate, HR, times the stroke volume, SV. At rest, the average cardiac output is 5 liters per minute, about. Atrial fibrillation occurs when depolarization of the atria is erratic and does not create definite P waves. This can cause the heart to not have enough time to refill and therefore have low systolic pressure, among other complications. Myocardial infarction occurs when the blood supply to heart tissue becomes blocked or ruptured, resulting in heart muscle damage and cardiomyocyte death. This is called a heart attack and will cause abnormal QRS complex patterns. Heart failure occurs when the cardiac output is insufficient for the body's needs. There is systolic heart failure, which is where the heart has trouble pumping blood, or diastolic heart failure, which is when the heart has trouble filling back with blood. And then mortality refers to death. 9,877 participants with an average age of 55, and that's plus or minus 13 years. 54.9% of the participants were female, and there were a total of 34,948 ECGs recorded during the study. Participants were residents of Framingham, Massachusetts, beginning in 1948. In 1971, the second generation cohort, which included the children of that first generation plus the spouses of those children, were added. Again, in 2002, the third generation cohort was added, as well as any new members that joined the first cohort or the second cohort. In 1994, residents were from underrepresented racial and ethnic groups were also added. So this is a longitudinal study lasting several generations. ECG age may correlate with mortality and heart failure in the Framingham Heart Study, which is a long-term and community-based trial rather than relatively short clinical settings that ECGs have typically been looked at. So chronological age, which is the age after birth, so years, months, days, is compared to ECG age, and that is determined using an algorithm-based prediction model. This model detects and extracts features directly from raw ECG waveforms to predict ECG age. The difference between the chronological age and the ECG age is called delta age. And again, that's the difference or subtracted. If participants' delta age is positive 9 years or more, they're considered accelerated age. Basically, their heart is older than they actually are. If a person's delta age is within plus or minus 8 years of their chronological age, they are considered normal aging, meaning their heart is about the same age as they are chronologically. If a participant's delta age is negative 9 years or less than their chronological age, they are considered decelerated, meaning their heart is actually younger, meaning their heart acts younger than their actual age. Clinical variables were determined through and based on interviews, physical examination, and laboratory measurements. And risk factors were considered. Common cardiovascular disease risk factors would include current cigarette smoking, that's smoking within the last year, medications for blood pressure, diabetes, and lipid-lowering medication, body mass index, systolic and diastolic blood pressures, and those would be potentially treated with medication. Another risk factor is diabetes, as well as just the lipid levels. So that would be HDL levels, LDL levels, and total lipids. In Figure 1, there are lots and lots and lots of course, data here. But what we are seeing is we're seeing a Pearson correlation coefficient of 0.81, pretty close to 1, which shows that there's a very strong correlation between chronological age and the estimated ECG age among the study participants. And here we see participants with an ECG age of greater than 9 years or less than the less than the chronological age have a higher survival probability. So they are represented in the green line. So as time increases from when the data is taken, they have a better than average survival probability. Participants with an ECG age within the range of the +8 or -8 of their chronological age are in blue, and they are represented, and they have that average. So they're considered normal age. And then participants with an ECG age of greater than 9 years or greater are in red, and as time progresses, their probability for survival decreases faster than the other two cohorts. ECG age correlates with chronological age and is associated with all-cause death. Myocardial infarction, atrial fibrillation, and heart failure in the community setting. A 10-year increase of delta age is associated. So again, if the delta age is a positive 9 or more, that would be considered accelerated. So at this particular interval of 10-year increase of delta age, there is an 18% increase in all-cause mortality, 23% increase in atrial fibrillation risk, and 14% increase in myocardial infarction risk. Both of those, the AF and MI, are related to the P and the T waves of an ECG. And there's a 40% increase in heart risk characterized by, and that's typically characterized by a longer ECG QRS complex. Using multivariable models, accelerated aging is associated with 28% increase in all-cause mortality, while decelerated aging was associated with 16% decrease in all-cause mortality. Because ECG is widely available and low cost, ECG age can potentially be used as a scalable marker of cardiovascular risk and can be used to strategically promote cardiovascular health. Thank you for listening and learning about ECG age and how it can be used to determine risks and health outcomes.